I'm going to be placing a nasal cannula on our patient here. The nasal cannulas are a low flow oxygen device that depends upon a patient breathing normally or being eupnic. The patient's respiratory rate, inspiratory flow, and tidal volumes should all be normal. When the patient is eupnic and you utilize a low flow device, the FiO2s can be approximate with the nasal cannula for an adult on a 100% from the wall. So wall is always 100%. With that, 1 liter is 24%, 2 liters is 28, 3 liters 32, 4 is 36%, 5 is 40%, and 6 liters per minute is 44%. A nasal cannula on an adult can go from 0 to 6 liters per minute. When you get into neonates, you will find out that you can give less than 1 liter per minute at a certain FiO2 because you'll be giving this off of a blender. For our purposes, we will be dealing only with adults. So you can see a difference. This is an adult size, that's an infant or pediatric size. So for ours, we will be doing an adult only. Here is a nasal cannula. You can see it has a slight curve. That curve will go up and into the patient's nose. So when I have already performed my hand hygiene, I have introduced myself, and have explained the procedure to the patient. Hi, Mr. Jones, how you doing? My name is Dr. King. We'll be placing you on a nasal cannula to give you a little bit of oxygen, okay? All right. This will go up and over the ears. And then pull the little lariat up. You do not wish to pull very tight because you can cause pressure ulcers here on the cheeks, on the nasal septum, or on tops of the ears. Anytime the patient has a facial ulceration, that is an automatic stage 3 ulceration, and it gets reported to the state. Okay. This nasal cannula will be running up to 6 liters per minute. If you are running at 4 liters per minute or higher, you need to use a bubble-through humidifier. Water would be in here. The oxygen comes down and just bubbles through, and you connect this end to the bubble-through humidifier. If you're not using humidification, this end will connect directly to the oxygen flow meter to the Christmas tree. Something like this. I will cover the humidification more when we go over humidity after midterm. So you'd set the ball on the flow meter at the oxygen level you want and read it from the middle of the ball. So in summary, this is a nasal cannula, a low flow oxygen device. The oxygen is approximate with the rules of 4. You can run it up to 6 liters per minute. Bubble through humidifier is typically utilized for 4, 5, or 6 liters per minute. If the patient is complaining of a dry nose, go ahead and put a bubble through humidifier on it. That is not a problem. If the patient becomes tachypnic or in distress, then the approximate FiO2 will go down because you're blending in more room air. If the patient becomes bradypnic or their breathing pattern severely slows down, the approximate FiO2 will increase because they're not breathing in enough FiO2. If the patient becomes short of breath or has a higher oxygen demand, then you may need to switch them over to a device called a Venturi mask, which we will be covering. This is the nasal cannula for an adult.